Hello again, my name is Dr. Ahmed Kumar, clinical lead at Dr2U and a practicing NHS GP. After graduating from Cambridge University over 15 years ago, I've amassed a wealth of academic and clinical medicine experience. At Dr2U, we like to inform, educate you, and help you along that journey towards becoming master of your health. One of the ways we like to do that is by providing you with good quality, trusted information via way of these videos that we record to help you along that journey. So it would be really good to hear from you about future topics you'd like us to discuss on one of our videos. Now, I want you to remember that what we're going through here today is general advice. It's not about your specific situation. Whilst there's a lot of useful self-help information that you can use, if you've got any symptoms, it's important that you speak to your doctor so you can be given the best management advice for your particular circumstance. What I want to talk to you about today is breast cancer screening in England. Before going into the details, I just want to introduce some important general understanding about screening. So what is screening? Screening is the ability to detect a disease at a very early stage, or the risk factors of a disease, so that interventions and treatments can be put in place that will lead to a much better outcome for the patient, which might mean living much longer than if the disease was detected at a later stage, or completely curing the patients so they don't develop the disease at all. Therefore, any disease that is screened for at a population level, it is important that that disease has a significant public health impact in terms of how many people it affects, and also, how many people suffer long-term consequences from this, whether this is, a change in their quality of life, so the morbidity, or a change in their longevity, so their mortality. Otherwise, it's not worth screening a whole population. It is also important that for any screening program, there has to be a very good treatment for that disease. There's no point screening for disease and not being able to actually do something about it. Any test used for the purpose of screening has to be able to detect the disease at a very early stage before patients develop symptoms, and we call this the sensitivity. So it has to be highly sensitive. It is also important that the test doesn't cause any harm to patients, because you're screening members of the population that do not have any symptoms, and many of whom may never develop the disease. So it has to not cause any harm. It is also important that it is of reasonable cost, so it has to be cost effective, because it would otherwise be almost impossible from a financial point of view to be able to screen the whole population. The test has to be widely available, as must be the interventions, so the treatments that are put in place if the screening test is positive, they have to be widely available also. So let's talk a bit about breast cancer screening in England. Well, in England, women between the age of 50 and 70 are invited routinely every 3 years to have their breasts screened. The test that is done is called a mammography. I'll tell you a little bit about this in a little while. And a woman is invited, sent a letter in the post, not from their GP, but from the breast cancer screening team. Once that letter is received, you're normally informed about the date and time to go along for your breast cancer screening test, so your mammography, and you simply turn up. If it's not convenient for you, you can actually call them up and change the date and time. Now, there is currently research trial going on in the UK as of December 2020, that's looking at screening women between the age of 47 and 49, and then women between the ages of 71 and 73. And so some women in those age groups may be invited to have breast cancer screening, and This is really looking at the benefits of extending the age range of women that are screened in the UK. So we know breast cancer is significant in the population, but is breast cancer screening an intervention that makes a difference? Well, breast cancer screening detects about 30% of cases of breast cancer, and it's thought to save about 1,300 lives in the UK every year. Now, if you also look at women who have developed breast cancer, and if you compare those who were screened before it was detected and those who were not screened, the death rate, so the mortality amongst those who were screened, who took part in a screening program, is reduced by 20%. So that's 1 in 5. What's also important is if, as a result of screening, the disease is detected a lot earlier, treatment can be put in place at an early stage, and it can usually lead to breast surgery that doesn't require the removal of the whole breast. So not requiring something called a mastectomy, where the whole breast is removed. A smaller area of the breast may be removed, and that means your breast structure in general is conserved. The architecture of the whole breast is conserved. So that's another benefit of the screening. So are there any harms, any potential harms with breast cancer screening? Well, one of the concerns sometimes is that you can have an overdiagnosis of breast cancer, and also that you can detect changes in a woman's breast that may suggest breast cancer, but that may never actually turn out to be breast cancer. And this can lead to potentially unnecessary tests and investigations done on the woman. Well, going through any process of screening, especially a cancer screening program, can be associated with a lot of anxiety for patients. So that anxiety management is also important as you go through the process. It is also sometimes thought that being exposed to radiation, especially in women who may never go on to develop breast cancer, but being exposed to radiation may increase your risk of breast cancer. Studies have shown that the risk of this is extremely small. It's less than 1 in 10,000 women develop radiation-induced breast cancer. So it's a very, very small risk. So you've got to weigh that against the benefits of actually going through screening and potentially detecting breast cancer early so that interventions can be put in place early enough. So let's talk about the actual test that's done, the mammography that's done in England. So as I mentioned earlier, you'd receive a letter with a date and time to go in, and you can reschedule this if it's not convenient at the time that you receive it. When you go, it's important not to use any deodorant or any sort of talcum powder because these can actually impact on the quality of the image that you get at mammography. Each breast is screened one at a time. Okay, so the breast is put into the screening device and pressed quite firmly with a clear plastic. It has to be quite firm, otherwise the quality of the image will not be good. And so it can be a little bit uncomfortable for some women, but it's very rarely painful. Okay, so both breasts are screened one at a time, and the screening process finishes, and you're contacted at a later date by the screening department with your result. Now, I mentioned anxiety management earlier, and this can be a very anxious period of time between when you have the screening done and waiting for those results. Now, approximately 1 in 23 women will be called back by the screening department because they found an abnormality that requires them to do further tests. So the way to look at this is that means 22 out of 23 women are not called back at all. Okay. Now, out of those 1 in 23 women, the vast majority of them will go through the test, and you know they will result in no further abnormalities found, and that will be the end of it. So it's important to bear that in mind. Now, is breast cancer screening compulsory in England? Uh, the definitive answer is it's not compulsory. You don't have to attend if you feel it's not right for you, but it's, I've gone through the pros and cons. There are a lot of benefits to having screening for breast cancer. Um, However, it's important that you know the pros and cons and make the decision that's right for you. Okay. Um, as a GP, I would strongly encourage that you attend for breast cancer screening. But if you have any anxieties, speak to your doctor to decide on what's right for you. There is a reasonable uptake in England. In the last couple of years, about 72 to 75% of women attend their breast cancer screening routine call-ups. And that still means about 25 to 28% don't attend. So that's quite a significant number. It's really important that we try and raise these numbers up as much as possible to help as many women as possible. Now, before I finish, I just want to talk about some important tips and special circumstances. Now, some women might be wondering, should I go for screening if I have symptoms? I have persistent unexplained pain in my breast, or your breast has changed in any way in terms of its shape, in terms of the way the skin appears, or you've noticed a lump. Should I go for screening? Well, screening, as I mentioned earlier, is only for people without symptoms. Okay, so if you have symptoms, even if your screening was in 2 weeks' time or 3 weeks' time, contact your GP as soon as possible. Contact your physician ASAP, so you can have urgent relevant tests if deemed necessary following an examination. Okay, screening is not for you if you got symptoms. If you've got symptoms, go to your GP. The second thing is, some women might feel that they should be having breast cancer screening much earlier than the age of 50, or much later than the age of 70, because of family history. So you may have first degree relatives, so your mother or your sister may have had breast cancer, and you might want to have your screening done a lot earlier. Now, this is also possible, but speak to your GP, and this can be arranged through discussion between yourself, your GP, and the breast care team. And now, for women who are over the age of 70, you can still go on having breast cancer screening, but you will need to arrange this yourself with the screening department. So you can contact them and make the arrangement every 3 years. You won't receive any letter. Now, what about women who've had a breast implant? You may be wondering, well, will screening still work for me? Absolutely. It's really, really important that you still attend any screening calls that you receive through the post. But it's important to know, though, that because of the implant, the image that you get from the mammography may be significantly distorted, and so they may need to get different views or additional views from the normal views that a woman without a breast implant would need when they attend their mammography. So just bear this in mind when you attend for your screening. Now, if you've made it this far, I just want to say a huge thank you to you for getting to the end, for investing the time to learn about your health on your journey towards becoming a master of your own health. Now, I hope going through this video today has helped you develop a better understanding of the breast cancer screening program in England. Now, you may be somewhere else in the world watching this. I hope the points discussed here would have been useful for you also. Now, remember, in England, screening is done from the age of 50 to 70. Over 70, you'll need to arrange it yourself. If you have a strong family history, it can be arranged before the age of 50. If you've got a breast implant, it's still important that you attend for screening. The key thing I want you to leave with is, if you have any doubts, any anxiety, don't stay away, don't keep quiet. Contact your doctor, contact the screening department, and have a discussion around it. I wish you all the best. I wish you longevity and good health.